In observance of National Nutrition Month, we're taking a comprehensive look into the medical problems associated with the obesity epidemic in America. According to the Centers for Disease Control and Prevention, during the past 20 years, there's been a dramatic increase in obesity in the United States, and rates remain high. More than 1/3 of U.S. adults and approximately 17% of children and adolescents aged 2 through 19 are obese.
In the next few stories, we'll talk with hometown health specialists about how being obese or overweight affects your body from head to toe.
Beginning with a look at how obesity affects, of all things, your hearing. According to a study published in the medical journal Obesity, being overweight or obese is associated with a higher risk of age-related hearing impairment, particularly if you carry your extra weight around your middle. How do you know if your hearing is at risk? The audiology specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery explain the different ways hearing loss presents.
Some of the first symptoms of hearing loss would be ringing in the ears. Ringing in the ears, what we call tinnitus, is something that is a symptom of damage to the hearing nerve. Symptoms of damage to the hearing nerve are tinnitus and hearing loss, and the two of them usually go together. So many people will come in and say, my ears are ringing, and one of the first things we will do is test the hearing, because we want to determine, is there some damage or degeneration of the hearing nerve that can be associated with that ringing.
We do a pure tone test. We do a conductive test where we put a bone oscillator that sits on the mastoid bone behind the ears. We do speech testing. We do tympanograms here as well. That actually kind of shows us to make sure that the eardrum is functioning properly. So all of those tests together indicate whether the patient has a sensorineural loss, a mixed loss, or a conductive loss. And the mixed loss is kind of they have sensorineural and a conductive component to the loss on that. So hearing aids, typically they fit sensorineural loss because that lies within the cochlea. Any other issues might lie in the outer or the middle ear. All the testing tells us that what's going on with the patient and their hearing.
Occasionally we will see someone who has a sudden hearing loss, and there are some ways of treating sudden hearing losses that we might see some recovery. But in general, when you start to see the gradual progression from the aging process, it's not something that we can recover. As aging occurs, there's damage to the hearing nerve. There's no way to stop it from happening. You'll just continue to have a progressive hearing loss over time. The hearing aids will help you hear better. They will not cause further hearing loss, and they will not really prevent further hearing loss.
For more information on hearing aids and the audiology services available at Lake ENT, please click on the Obesity and Hearing Loss story link on our homepage at yourhometownhealth.com.